So our speaker for today is Mr. Jibi Thankachan. He's a senior specialist and lead infection control and AMR expert with over 14 years of global experience. He's seasoned with over 14 years of global experience, seasoned and expert infection control professional. Oh, sorry. That's repeated twice. Over 14 years of experience in the healthcare sector, spanning Saudi Arabia, the UK, UAE, and India. He holds a bachelor degree in nursing and has extensive training and expertise in infection prevention and control, with a super specialization in surgical site infection prevention, advanced training in hand hygiene strategy management, an expert specialization in antimicrobial stewardship and resistance. So, with a virtual applause and ovation, can we welcome Mr. GB to the stage? You're welcome, sir.
So, good evening once again, everyone. So, today we'll be discussing about artificial intelligence and its emerging role in addressing antimicrobial resistance or AMR. So, you all know about antimicrobial resistance. It's one of the most critical subject right now discussed in and around the world, especially in the healthcare settings. And also artificial intelligence is one of the new technological advancement which is happening and which is going to conquer the entire world in the upcoming generation. So today in this class we are going to discuss about the integration of artificial intelligence or AI and its emerging role in addressing this global threat, that is the antimicrobial resistance. So, from today's class, what all things we are going to discuss: introduction to the AMR, that is a silent pandemic. Then we'll see about the overview of AI in healthcare. Then we'll see about the importance of AI and also the global AMR challenges. Then the importance of AI in diagnostic microbiology and detection of resistant pathogens. Then machine learning for resistant prediction. Then AI powered AMS programs. Then AI in surveillance and epidemiological monitoring. Then about the drug discovery and novel antibiotic developments happened in and around the world. Then AI in clinical decision support systems. Then what are the challenges, ethics, and the way forward. And finally, we'll see the summary and the conclusion. So these are the topics which we are going to discuss today. And the introduction to antimicrobial resistance, which is one of the silent pandemic the modern world is facing. So you are very familiar about this statistics, that is around 1.27 million people uh, death is directly caused by AMR annually around the data around the world. That is as per 2019 data. Then 4.95 million is the death which is associated with bacterial AMR per year globally in the current situation. So the expected death by 2050, if there is no action taken, it will be around 10 million people per year. So, what do you mean by antimicrobial resistance? As I discussed in my previous class, also, it is actually occurring when bacteria, virus, fungi, and other parasites, which is evolved to resist the medicine which is designed to kill them, that is the antibiotics. So, it can even render standard treatments ineffective, enabling infection to persist, spread, and it can even become a life threatening condition. So, which are the key drivers which leads to this antimicrobial resistance? That is overuse and misuse of the modern day antibiotics, poor infection control practices, lack of new development of antibiotics, new R&D programs, then agricultural overuse of antimicrobials, then inadequate diagnostics and surveillance. So these are the key drivers which promotes the antimicrobial resistance in and across the world. And you can see at the last, WHO declared AMR as one of the top 10 global public health threat. So in previous years, if you see, AMR was growing up and it was not one of the public health threats. But after 2000s, AMR is even coming and grown like a global public threat. Even WHO has declared as one of the top 10 global public health threats. So we'll see about the artificial intelligence and its importance in the healthcare industry. So we have got around six analytics which can even transform medicine through data-driven intelligence. So first is about the machine learning. Second is about the deep learning. Third is natural language processing. Fourth is the predictive analytics. Fifth one is big data analytics. And sixth one is the computer vision. So how this artificial intelligence it can transform this modern medicine through a data-driven intelligence. This is what we are going to see through these slides. So first is machine learning. So machine learning is when actually this computers learn data and it improvise over time without being directly programmed. So in healthcare, it can even help find patterns in patient data, or it can even predict things like disease risk or even treatment outcomes. So these are like algorithms that learn the data, which is help to identify the patterns and predict the outcomes of the treatment condition. Second is about the deep learning. So I'm just basically telling how this artificial intelligence will be helpful in the healthcare industry. This is not exactly focused upon the stewardship program because that type of slides is coming in the next slides. So we are just seeing how this artificial intelligence can impact the healthcare. So second is about the deep learning. So deep learning is like a more advanced type of machine learning. First is machine learning, that is a basic. Then deep learning is an advanced type of machine learning, which uses structures, then which is like around, similar to the human brain. So that is known as neural network. So some networks, it is acting similarly like a human thinking or human brain, which is known as neural networks. So this is actually very good at handling complex data like medical images. Then it can even help the doctors detect the disease such as cancer or any other condition more accurately. So this is known as deep learning. So AI can have a greater impact in detecting a complex disease conditions, or even it can detect cancers at a very early stages, and it can help doctors to a greater extent. Next is the natural language processings or the NLPs. So these are the extract which comes from the clinical notes or the literature of the patient, previous medical histories, previous patient, medical records, etc. So this actually uses any past and current data, to predict future health outcomes of the particular patient. For example, it can forecast how disease might spread, or if there is a cancer, how this metastasis of that cancer can happen. So it can identify the patients who are at risk of getting some complex diseases, or it can even predict a patient condition that it will get worsened or not. So this is known as natural language processing. So this will play a vital role in organizing the treatment plan for a particular patient. Next is the predictive analytics. So this predictive analytics, it can even forecast the spread of such diseases. It can even, in case of antimicrobial resistance, it can even detect the resistant pathogens or the patterns of that resistant organism, and even it can help in deterioration of the patient condition. So this actually uses any past and current data to predict the future health outcomes. For example, this can forecast how a disease can spread if there is a metastasis in case of cancer, or in case of microbial contamination, whether this can lead to a development of a resistant pathogens. So it can even identify the patient who are at risk of developing such complex condition, or it can even predict a patient condition whether it will be getting worsened or not. So next is the big data analytics. So these are healthcare, generates which can helps to generate huge amount of data, especially from the hospitals, lab, through research and other means. So this data analytics it will help in processing and analyzing all this information which has been gathered to find out the recent health trend. It can suggest improving the treatment outcome, and also it can even helps in large scale healthcare decision across the country or across the region. So it is a nationwide analytic. It's a big data analytic. The last one is about the computer vision. So this actually allows the machines to see and interpret the radiological images. So in healthcare, it analyzes the X-rays, the magnetic resonance imaging like the MRI scans, and also it can help in the lab by analyzing the microscopic images to quickly identify the diseases or any sort of infection. And even it can help the doctors to make faster and more accurate diagnosis. So all these AI technologies, if it work together to make a healthcare, it can create a greater impact into the modern medicine. So because it will be faster, it will be much smarter, and it will provide more accurate informations, accurate decisions, accurate detection of the condition, and also it will help the healthcare professional or the clinicians to provide the better care to the patients. So this is the impact of AI into the healthcare. Next, we'll see about the AI and the global AMR challenges. So we have got a four different categorization of game changers that is required in the field of artificial intelligence, and also what is the impact of these four game changers into the field of global AMR challenge. First one is about the global surveillance. So this artificial intelligence, it can gather large amount of health data from the hospitals and labs as well as countries around the world. So it looks for especially the patterns in infections and antibiotic resistance. By doing this in real time, this artificial intelligence can spot new resistant bacteria very early. It can even alert the healthcare authorities that there is a new development of resistant pathogen is happening, and even it can help in taking action because it before it is getting spread or nationwide problem or a widespread problem. So this can even synthesize real time genomic data. It can even synthesize clinical surveillance data from different countries around the world. So it can even predict for the enabling of the early warning for any resistant pathogen emergence, especially in the modern medicine. We are expecting it to have a lot of pan-resistant microorganisms. So this global surveillance AI can help us in detecting across the nation. So second is about the rapid diagnosis. So this AI powered or the artificial intelligence diagnostic, it can even reduce the time result, that is around 48 to 72 hours to around 2 hours. So this can even enable targeted therapy before this resistance can develop. And because traditionally, identifying infection or checking out the right antibiotic, it will take a minimum of 40 to 78 hours, 72 hours. So this artificial intelligence, what it will do, it will speed up this process by analyzing the samples, and also it can even generate medical data very quickly. And this allows the clinicians or the doctors to know what they are dealing with in very shorter time, that is around 2 hours. And so this patient can receive the correct treatment sooner, and also it can avoid unnecessary prescribing an inefficient or ineffective antibiotic. So third one is about the genomic intelligence. So this artificial intelligence, it can, works with the genomic sequencing, that is studying the DNA of the bacteria to understand how this microorganism is going to behave in a patient body. So it can even detect specific genes that causes this antibiotic resistance. It can even track how bacteria can spread between peoples or the persons, or how it can spread from one area to another area, and even it can links to related outbreaks which has happened in previous generations or in the previous times. So this actually helped the researchers or the scientists, especially the doctors, to understand the problem at a deeper level and also to respond more effectively. And especially it can help the researchers to develop more R&Ds in the field of antibiotic development. So genomic intelligence is going to be a real game changer, as artificial intelligence is going to play a vital role in antimicrobial resistance challenge. So the next one is about the optimized prescribing, because artificial intelligence, it can support doctors in choosing the best treatment for each patient. So it can even consider factors like the patient medical history. Then it can leads to the local antibiotic resistant trend developing, and also it can help in how different antibiotics or different drugs works in the different patients' body. So based on this, it can even suggest the most effective antibiotic for the patient. Even it can helps to predict the correct dosage of the antibiotic and also the correct duration, because how long the antibiotic need to be taken. So this will further reduce the misuse of the antibiotics, and also it can help in slowing down the resistance. So this optimal prescribing algorithms, it can even helps in analyzing the patient history. It can helps even in generating a good antibiogram data, and also it will helps in the pharmacokinetic field to recommend the right antibiotic dose and the duration. So if you see the overall idea about it, it doesn't replace doctors, because AI cannot replace clinicians at all. It helps them make faster, smarter, and more accurate decisions in fighting this global AMR challenge. So this is actually going to be a game changing effect, because especially global surveillance, rapid diagnosis, genomic intelligence, optimized prescribing. So AI integration or artificial intelligence integrating into this four game changers, it is going to tackle these challenges in a much better way. Next is about the AI in the diagnostic microbiology. So artificial intelligence, even it can, have a greater impact in this diagnostic microbiology, because it can provide faster, smarter, and more accurate pathogenic detection, especially in the labs. So we have the integration of AI into multi-TOF. We have the AI powered culture analysis for the patient, and we can also AI powered rapid PCR interpretation. So you all know about MultiTOF. It is Patrick assistant
I
laser
saw.
disruption. Pardon? Any doubts? Because somebody has interrupted. So MultiTOF means matrix assisted laser disruption ionization. So this is the enhanced spectrometry, which helps to analyze the pathogens, and also it can predict the resistant profiles within 30 minutes if it is integrated with artificial intelligence. So this is MultiTOF. It's actually a machine used to identify the microorganism based on their protein patterns. So when it combines with artificial intelligence, it becomes even a smarter machine. So it improves the accuracy, it speed up the identification, and even it can help detect subtle difference between the different microorganisms. So within 30 minutes we can able to identify the pathogens through the multi-TOF machine when it is integrated with artificial intelligence. Next is about the AI powered culture analysis. So in traditional labs, scientists examine this bacterial cultures manually. So this artificial intelligence, it can help analyze these images and cultures automatically, and it can even detect the growth patterns. It can even helps to identify the count colonies, and also helps in identify organism faster and more consistently than the human, like manual integration. So 95% of accuracy in resistance phenotype detection is possible when AI is powering the culture analysis detections. Next is about the rapid PCR interpretation. So this PCR test, it can detect the genetic material of pathogens. So AI integration of PCR, it can helps in interpret this polymerase chain reaction results very quickly and more accurately. And also it will reduce the errors and provide faster diagnosis, which is important for infection that needs urgent treatment. So it will take a minimum of 2 hours from sample to generate a resistance gene report. So this artificial intelligence enhancing this microbiological diagnostics by making the testing more faster, more accurate, as well as it is creating a less dependency on the manual workforce. So AI in diagnostic laboratory, so or diagnostic microbiology is going to be a real game changer in the future generation, because it can help out in faster, smarter, and more accurate pathogenic detection in a very less time. So it can promote a better treatment outcome and a better use of antibiotics in the future generation. So the next slide is about the machine learning for the resistance prediction. So this is actually a very important aspect, the machine learning for resistant prediction. So think of this slide as showing how artificial intelligence acts like a very smart early warning system. So instead of waiting for a patient to fall on an antibiotic, this machine learning algorithms, it studies patterns from thousands of past cases, like previous patient records. So it can help in bacterial gene sequencing. It can identify the previous lab results, and it learns to predict which bacteria will resist which drugs even before the testing can be done. That is known as the prediction output. So this slide, it actually shows a simple four-step flow. So raw data that is going in, the algorithm that will be picking out these important features, and a model which runs the analysis, and also an outcome, a risk score or a resistance prediction. So this actually doesn't guess, it learns. So machine learning, it doesn't guess anything, it actually learns. So tools like deep ARGs or risk finders, they are already doing this in real hospitals. So they will predict the multi-drug resistant organisms with almost 85 to 92 percentage accuracy, which is often better than a doctor relying on a experience alone. So predicting multi-drug resistant organisms, or these resistant pathogens, it actually it has got a great challenge in the modern medicine. So with the AI integration, in the future generation, we can able to do it with 85 to 92 percentage accuracy. And also we can develop analytical institutional antibiogram trend to update the empirical therapy guidelines in real time. And also it can help in adjusting for the local resistant rates. This is very, very important in this antibiogram intelligence pattern. This is one of the game changing pattern in a machine learning for resistant prediction. So even deep learning, like as I mentioned in the previous words, like deep learning tools like deep ARGs, rest finders, it can even predict the horizontal gene transfer of resistant determinants between the organism. And also it can help in tackling the patient risk stratification, especially the patients who are in the ICU, who are immunocompromised, who are having a prior antimicrobial resistant pathogenic exposure, and we can able to flag them for targeted infection control intervention. So predicting before it's too late, this is what machine learning for resistant prediction it's always aims for. So next slide we'll see about the AI-powered antimicrobial stewardship program. So this slide is actually the heart of the presentation. I can able to say this is one of the most important slide where the importance of AI is described in coordination with the antimicrobial stewardship program. That's why I mentioned it is one of the heart of the presentation. So those who are working in clinical care, antimicrobial stewardship is basically the discipline which makes sure antibiotics are used wisely. That's what we are here, because through us we need to ensure that our community or our hospitals or our country is using this antibiotics wisely. So like right drug, right dose, right duration, right route. So artificial intelligence or smarter stewardship program, it supercharges these five things. Which are the five things? Right drug, right dose, right duration, right route. These are the most important things which is supercharged by artificial intelligence, and it is going to create a smarter stewardship program across the nation. So this slide, it actually covers six practical things. So real-time audit feedbacks, de-escalation prompt, IV to oral switch, duration optimization, aware classification and monitoring, and multidisciplinary integration. So this practical things AI, it does in stewardship most oftenly in upcoming generation. It monitors prescription 24 into 7 against guidelines like WHO, aware programs and IDSA, and it can even flags when a doctor prescribes a broad spectrum antibiotic when a narrow one is required. So this will help identify patient ready to switch from IV to oral antibiotics, because it can even shorten the hospital stay or length of stay of the patient in the hospital, and it can even track whether a reserve category antibiotics or a reserve antibiotics, the last resort one, are being used appropriately, or if there is a misuse of a reserve antibiotic is happening. So this message, for antibiotic development as well as integration of artificial intelligence, it is not going to replace the stewardship team. It is going to give them eyes everywhere at once, because this is going to help the stewardship team in a much advanced level, where a real-time audit and feedback can happen. Even it can help in de-escalation, because the step down of broad spectrum antibiotic to narrow spectrum antibiotics is very helpful when the culture reports are available. It can even help in reducing the selective pressure for the physicians, and helps in IV to oral switch, because it will identify the eligible patients for switching from IV to oral antibiotics, and it can detect the criteria automatically. What is the outcome of that? It can even shorten the hospital stay. It can even reduce the IV related complication for the patient. Duration optimization, which is very important aspect, because these algorithms know it analyze the clinical response parameters, and it will recommend the optimal antibiotic course duration for the patient, and it will helps in preventing the over treatment, especially with the OPAT guidance. Then about the aware classification monitoring, as I mentioned before, these tracks, access, watch, and reserve antibiotics consumption ratios as per the WHO standards, as per the WHO's aware framework, and even it can alert for inappropriate usage of this watch or reserve antibiotics. And the final thing is the multidisciplinary integration, because AI related antimicrobial stewardship programs or the platforms, it will always integrate, or it will always have a coordination with ID consultants, the clinical pharmacist, as well as the microbiologist or the infection control staff, to deliver a coordinated and data driven stewardship decision. So smarter stewardship, it always aim for a better antibiotic stewardship program, and AI or artificial intelligence, it is going to play a vital role in choosing out this smarter stewardship program across the future generation. So the next slide we are going to focus on in artificial intelligence in AMR surveillance and the epidemiological aspect. So we have got around six aspects here. It's mainly focused upon the on health surveillance, which includes the human, animals, and the environment. So we have the global AMR monitoring, we have the wastewater epidemiological advancement, we have the genomic epidemiology, we have the outbreak detection, we have the One Health platform, as well as we have got the social media monitoring. So in global AMR monitoring, this artificial intelligence, it can integrate data from the GLASS program of WHO, the net program of years, as well as the Sentinel network, which help to map this resistance spread in real time, and also it can help in predicting the geographical hotspot of this resistant microorganism. Next is about the outbreak detection, because this machine learning algorithms, it will detect the unusual clustering of resistant isolates weeks before the traditional surveillance could identify an outbreak, because the prediction will be much faster than a traditional outbreak investigation. Then the wastewater epidemiology, because AI, it will helps in analyzing the environmental sampling of wastewater for the presence of the resistant genes, as well as for the antibiotic residues, and also it can create an early warning system at the community level to predict the resistant spread. Then integrated AI surveillance, it can bridge the human factor, it can help in the veterinary integration, as well as it can link the environmental data to detect any zoonotic resistant transmission or any pandemic conditions. Then it can help in genomic epidemiology, because AI powered whole genome sequencing or WHS, it can analyze the traces of transmission chains in hospital outbreaks with a single nucleotide precision, because this is very important. Then finally about the social media monitoring, which is not happening in the current world, because NLP or this can even scans different literatures, it can even analyze the health forums, or it can even reports to track this antibiotic misuse trends, and also it can alert the public health AMR awareness, to the public, as well as it can even helps in reducing the gap of this resistance awareness to the community. So WHO Glass, ECD, EARS, NET, CDC, AR threats reports. So these are different AI, connecting link to help out in these global surveillance network. So AI in AMR surveillance and epidemiology, it's mainly focused upon the One Health surveillance. It will links the human, it will links the animal or the veterinary science, as well as the environmental factors to tackle this resistant microorganism. So next we'll see about the AI in the novel, antibiotic drug discovery. So this is actually a very important you know aspect. So we have the target IDs, we have the compound screens, we have the lead optimization, we have the preclinical aspect as well as the clinical trials. So if you see in 2020 we 2023 and 2024, how this actually developed. So in 2020, this MIT researchers, they used deep learning to identify halicin. That is the first antibiotic discovered by artificial intelligence. So halicin is one of the first antibiotic which is developed by using artificial intelligence, and this is effective against Clostridium difficile, Acinetobacter baumannii, and Mycobacterium tuberculosis. So, second in 2023, the landmark discovery happened is about Abusin, which is actually an AI discovered antibiotic. It's a narrow spectrum antibiotic. So, it's mainly target Acinetobacter baumannii, which is a critical, priority WHO pathogen. So, this can even reduce off-target resistant effects. In 2024, they have a large language model drug design, which is helps in training on the chemical databases to generate any novel antibiotics with a prescribed resistant profile. So this is an advancement in the development of LLM designed drug, and it mainly helps in identifying the novel bacterial targets, but it's not yet a mutated one. So this deep learning screens, it can help in screening out the millions of molecules in silico aspect, that is known as the compound screening. And because this is a bit complicated, this is actually a complicated slide because I don't want to add this one into that. But just for your understanding about the halicin and abosine, I just added all these slides onto you. So it can even helps in lead optimization because these generative designs, it can help in compounding with the optimal pharmacokinetics programs. So there is a preclinical aspect also because machine learning, it predicts toxicity, as well as these drug resistant properties very early. And also about the clinical trials, if you see, because artificial intelligence, it can help in designing the trials, as well as it can even helps in designing a patient stratification. So these revitalizing of this antibiotics pipeline with the artificial intelligence, it can narrow out the resistance, it can improve the treatment outcome, or even it can help out in the early detection of this resistant pathogens. Based on that trend, we can able to develop new antibiotics, which is mainly happening through the integration of artificial intelligence, which is going to cover out all these global resistance patterns, or which is going to cover all these global resistant challenges which is faced by the modern world. So next is about the AI-driven clinical decision support system. This is actually not very important because it is going to be a bit complicated. So I don't want to discuss. You can go through this slides because I'll be sharing the slides with you. So you can go through the slides and you can Google out to get further details, because if I start to explain everything, the time will not be permitting for it. So AI in infection prevention and control, because this is very important thing, because preventing AMR transmission before it of course is one of the most important vitalizing target for us as an AMS program reviewer. So contact precaution alerts is very important because AI screens admission data to identify the patients requiring contact or droplet precaution as well as airborne transmission, especially for MR, CVRE, CRE, CRAB conditions, or even multi-drug resistant TB conditions or other any MDRs automatically. So even AI-powered vision systems like cameras and machine learning, it can even monitor hand hygiene compliance in real time at the point of care. Even it can provide instant feedback. Next is about the environmental contamination mapping because artificial intelligence, it can analyze the environmental cultures and also it can help in auditing the cleaning data to identify the high risk surfaces as well as gaps in terminal cleaning protocols. Then HI prediction modeling because predictive models it can identify patients at high risk for CLEPSI, COUTI, VAP, as well as SSI. It can even enable the preemptive bundle application program. Then isolation room optimization because artificial intelligence it can allocate the isolation capacity dynamically based on the MDRO risk source as well as real time bed availability, and it can even helps in reducing the cross transmission, and also it can helps in identifying the outbreaks and can provide an early warnings because cluster detection of this algorithms it will help this HAI outbreaks 3 to 5 days earlier than traditional case-based surveillance methods. So artificial intelligence in IPC it always aligns with WHO's core components, and it can even helps this ECD or CDC guidelines for MDRO prevention in acute care settings. So, artificial intelligence in infection prevention and control, it's actually a vital component. It can even helps in preventing the transmission of this antimicrobial resistant pathogens before it start to occur. So next is about the AI in antibiotic pharmacovigilance and usage monitoring. So in this aspect, this pharmacovigilance actually means watching over how drugs are used after they are prescribed. This is what exactly pharmacovigilance means because they will tackle the safety patterns and the appropriateness of the drugs which is being prescribed. So through this slide which we are going to discuss how this artificial intelligence takes the job from a manual slow monthly audit to a continuous automated real-time process because we need to ensure a safe, effective, and judicious antibiotic use at every level. So if artificial intelligence is integrated in artificial antibiotic pharmacovigilance and usage monitoring, we can ensure a safe, effective, and judicious antibiotic use at every level. So the four areas covered are DDC tracking. So artificial intelligence monitors how many defined daily doses of each antibiotics are being consumed per thousand patient days and compares it to the national benchmarks. So it always have a comparison with the national benchmark by monitoring the daily defined doses. Second one is about the days of therapy because it always flags when a patient has been on antibiotic lower than the supported evidence based days. Third one is about the reserved antibiotic monitoring. So any prescription of a last resort drug like colistin or any cefiderocol or any high-end antibiotics, it can even automatically triggers a mandatory specialist review because if there is a GP or if there is a practitioner or a any low-level doctors who is prescribing this antibiotic reserved antibiotics like or high-end antibiotics like ceftazidime and avibactam or colistin or cefiderocol, so this will trigger out a higher end prescription, or it can even helps in detecting for a consultant consultation and approval. So this will do a real-time monitoring of this high-level antibiotics, and also it can help out in the misuse of the high-level antibiotics, and it can even detect any adverse drug reaction. So artificial intelligence can read the clinical notes using this NLPs to catch out the unreported side effects like kidney damage or any development of Clostridium difficile infection that might even go unnoticed. So the artificial intelligence, it can even turn out this antibiotic monitoring from a monthly reports into a lively safety dashboard, because it always aligns with the WHO's action plan on antimicrobial resistance, and also it can help in optimizing the use of antimicrobial medicines in the human health. So this is very important because integration of this AI into the antibiotic pharmacovigilance or the trend monitoring of its usage, it can help in ensuring a safe, effective, as well as the we can able to ensure that we are using the antibiotic judiciously at every level of the treatment. So AI enabled rapid diagnostics and point of care testing to bring out the laboratory into the bedside. So if you see a traditional versus AI powered point of care testing things, so we have got the aspect, we have got the traditional methods, and we have got the AI powered POCT. So if you see the time to result to get a culture result is in traditional methods is almost like 48 to 72 hours. So if in case of AI, it will be less than 2 hours. To detect a resistant gene, it can be only through phenotypic only. But when it comes to artificial intelligence, it is through by genotypic plus phenotypic we can able to identify a resistant gene. The accuracy of the reporting, it's always depend on the operator or the lab staff who is reporting the result. But when it comes to AI, it will be a standardized machine learning accuracy will be there, which is around 85 to 92 percentage, which you had seen in the previous slide. So the integration of data, it's always in traditional methods we have got a manual reporting, but in AI powered, it will be always integrated with the EHR, and also it can even trigger the auto alerts in case of a resistant pathogen development or a critical result. If it comes to the settings, it will be through the laboratories in traditional methods or through a central laboratory. But when it comes to AI, it will be always in the bedside, or even it can help in remote detection or remote presentation of the data. So this artificial intelligence integrated POCT device like BioFire Film Array, Cepheid Gene Expert, Vitek Multitops, and these are all going to transform the empiric prescribing to a different level. So AI enabled rapid diagnostic as well as POCT is going to have a greater impact, and it can even bring the laboratory into the bedside. So this is going to have a greater change in the upcoming generation once we enable this artificial intelligence into rapid diagnostics or into the laboratories. So next is about the AI and the genomics, because decoding resistance at the molecular level is very important, because from genome to bedside, it's always depend upon the power of this artificial intelligence.